The best time to practice hand expression is after you've had a warm shower, because hand expression actually works better when you feel warm, okay? Or maybe you can place a warm towel on your breast before you start. Hey guys, welcome back to my channel and welcome to another video. So we are still on the breastfeeding topic, or maybe we can call it breastfeeding series at this point. And today we'll be talking about how to hand express your breast milk or your colostrum before and after the birth of your baby, okay? I got a comment from one of my previous breastfeeding videos, and this person was constantly requesting that I make a video on this topic, and here we are, okay? So let's talk about it. Hand expressing to collect your colostrum or your breast milk is a very important skill for you to know and practice, especially if you're a lactating mom or if you plan to breastfeed your baby, okay? Because it can actually help you to manually remove some of your breast milk, especially when you feel engorged, okay? And this is generally considered safe to start practicing around 37 weeks of pregnancy, okay? But please make sure you consult with your doctor or your healthcare provider before you start trying to hand express your breast milk, okay? Especially if you had any form of complication during the pregnancy. Now you might be wondering, why do I need to hand express my breast milk when I can just use breast pump to get it out? The reason is because hand expressing your colostrum or your breast milk is actually a better option, because colostrum is thick, it's produced in very small amounts, maybe just little drops here and there, okay? And sometimes it's very difficult to get it out with breast pump because it will end up sticking to the sides of the bottle or to the sides or to the parts of the breast pump, okay? And again, let's be honest, it's not really everybody that can afford a good breast pump to express their breast milk, okay? So that's why it's really important that you know and practice this skill before the arrival of your baby, okay? So let's talk about some of the reasons why you might want to hand express your breast milk or your colostrum and store it before your baby arrives, okay? So as I already mentioned, the first reason might be just because you want to know the skill, you want to practice it, and you want to be sure that you can do it when the need arises before the birth of your baby, okay? The second reason is if you had some type of complications in your pregnancy and you are aware that your baby might end up spending some time in the NICU, or if you know that your recovery process is going to be difficult and you are going to be separated from your baby for a while, and during that period of separation you don't want your baby to have formula, you still want them to have your breast milk, then that might be another reason why you want to hand express your colostrum or your breast milk and store it. Another reason is if your baby is born with any birth defects that can affect their ability to latch properly. Issues like cleft lip, cleft palate, tongue tie, and all those other complications that can make the baby not to latch properly and breastfeed very well, okay? Now let's look at some of the few items you are going to need, okay? You're going to need a spoon. You're also going to need a syringe. This is just a regular syringe, but in ideal sense you're going to need the sterile syringe that comes with a cover, a cap, okay? I think you can get them from the pharmacy or just request for it from the hospital. You're also going to need a cup or a medicine cup, those small medicine cup that normally comes with children medication, okay? Now that we've covered some of the reasons and the materials that you need, let's get into the technique proper, okay? Okay, so this is going to be our imaginary breast today, okay? Because obviously I can't use my breast to demonstrate this, but hopefully you get what I'm trying to show with this breast, okay? So this is your nipple. This is going to be the nipple. Okay, so I'm going to try and design the areola. So this is going to be the areola. Okay, this dark part around the nipple. This is not the best, but please bear with me, okay? Okay, so when you're ready, the first thing to do is to massage your breast, and you're going to do that with the part of your finger, and you're going to go from top like this, massage towards your areola and towards your nipple, okay? And you're going to do that on all sides of your breast. You go around until you cover all parts of your breast, okay? So you're going from top like this, and you massage towards your areola and towards your nipple. You keep going around until you've covered all parts of your breast, okay? Now if you don't want to do that with the parts of your finger, or maybe you are not comfortable with that, another way that you can do that is with your knuckles, okay? And again, you're going to go from top and you massage towards your areola and towards your nipple. Just the same way you did with the pads of your finger, you go around until you've covered all parts of your breast, okay? And remember to do it towards your nipple and towards your areola, okay? So now that you've done the breast massage, it is assumed that you've woken up the breast tissues or the milk ducts, okay? Now the next thing to do is to form a C shape with your thumb and your pointer finger, or is this called index finger? I don't know. Anyways, you're going to form a C shape like this with your thumb and your pointer finger, okay? Just at the edges of your areola, that's the dark side, the dark circle around your nipple, okay? Maybe a few centimeters away from the areola, okay? So you form the C shape, and make sure your finger is pointing, your two fingers are pointing, are facing towards the nipple, okay? Remember, this is our nipple. Now make sure you stabilize your hand. So after you form the C shape, the next thing you're going to do is push your breast back into your chest, press or compress, okay, and then you release, okay? I'll take that again. So form the C shape, make sure your hand is stable, you push back into your chest, press, and then you release, okay? And when you're pressing your two fingers together, or when you're compressing, try to make sure that your two fingers are stable, okay? Don't let it slide towards your nipple or towards your areola, because we are not trying to milk the nipple, okay? Because the milk ducts are actually located around the areola, just around this part. There's no milk ducts right at the nipple. When I'm pressing on this balloon, it's sliding, my finger is sliding because obviously it's a balloon, okay? But when you do it on your breast or a normal human breast, try to make sure that your finger is not sliding forward when you are compressing, okay? So push back, compress, and release. And you have to do this for about 3 to 5 minutes on each breast, okay? And also you have to make sure that you're doing this on different sides of the breast. Remember, this is where the milk ducts are located, okay? So you have to try different angles of the breast, push back, compress, and release, and you change position until you've done that on all parts of the breast. Also, before you start, make sure you use a warm cloth or a warm towel to clean the tip of your nipple, so that when the milk starts flowing, it will be able to flow freely, okay? And while you're doing that, you have to have your spoon at your nipple ready to catch any single drop that comes out, okay? Remember, if you are doing this before pregnancy, you want to collect that colostrum, which is considered liquid gold, okay? So every single drop counts. And moreover, colostrum is produced in little quantities, okay? So every single drop, like I said, is very special, is very important, okay? So you get your spoon or your cup at your nipple ready to catch the drop. In this case, I would say spoon is actually better, because if you are using a cup, it might end up sticking to the sides of the cup and it will make it difficult for you to collect on the syringe, okay? So you get your spoon ready. As soon as you see any drop coming, use your spoon to get it off the nipple. You can collect several drops at a time, and after collecting it, next thing is to use the syringe and just suction it from the spoon, okay? Or if you have your partner around or anybody around that can help you, then you can just get them to use the syringe and suck it up from the spoon, so that you just focus on the compressing or the pressing part, okay? You can also put some warm cloth or warm towel on your breast in between the compressions, okay? This will also help to wake up the milk ducts that are around the areola, okay? Now, if you're doing this for the very first time when you're still pregnant or after you've had your baby, you may or may not see any drop of milk at all. You may see 1 or 2 drops the first time you do it. That's fine. If you don't see anything the first day you do it, that's fine as well, okay? Remember, colostrum is produced in very little quantity and is thick and sticky as well, okay? So just keep practicing, okay? You can start by doing it once a day, and then you can increase to maybe 3 times a day towards the end of your pregnancy, okay? And when you finally start getting some drops of milk, make sure you store whatever you've collected in the fridge immediately, okay? If you plan to express again later in the day to add to the previously collected one that you stored in the fridge, then you have to cool it off again before adding it to the previously collected one, okay? So what you can do is, the second one that you're collecting, the second batch, you can collect it in a medicine cup or a spoon and cool it off in the fridge. So if you're using a medicine cup, make sure that you're not just letting it stick to the sides of the cup. You can collect it on one side of the cup so that everything just follows that single line to flow to the bottom of the cup, and then you can cool off the cup in the fridge and add it to the previously collected one. Okay, colostrum or milk that has been stored in the fridge can only stay there for 48 hours. Okay, you have to use it within 48 hours. After 48 hours, it's no longer considered safe, and that means you have to discard it. Okay, and if you are going to freeze it, if you are going to put it in the freezer, it can stay there for up to 6 months. Okay, and you need to make sure that you label it. You label the syringe by putting the date and the time that you collected it. Okay, all right guys, that's it for today's video. I hope you enjoyed watching, and I hope you've been able to learn how to perfectly hand express your breast milk or harvest your colostrum before the birth of your baby. Okay, remember, practice makes perfect. Okay, if you do this for the first time and you don't see any milk coming at all, don't give up. Okay, keep practicing. The more you practice, the more you get better at it, and the more milk you can potentially express. Okay, thank you for watching, and don't forget to like, share and subscribe to my channel, and I'll see you all in my next video. Bye. Bye.